This recording is Chapter 7, the Axial Skeletal System, Part 1 of 2. The skeleton can be broken down or divided into two main portions. The axial skeleton is everything along the axial axis, where we have the skull, the vertebral column, the thoracic cage, which includes the sternum, the hyoid bone, which is a little bone up here in front of the cervical vertebrae, and tiny little bones in the ears referred to as ossicles. The appendicular skeleton refers to arms and legs, which are appendages or extremities, and the girdles that hold them on to the axial skeleton. There is a pectoral girdle for the upper extremities and a pelvic girdle for the lower extremities. We're going to begin speaking about the axial skeleton with the skull. The skull includes cranial bones and facial bones. The cranial bones make up the cranial cavity where the brain lives. They include 8 bones, 2 of which occur in pairs, 4 are single bones, and the cranial bones include the single frontal bone, 2 parietal bones, a single occipital bone, 2 temporal bones, a sphenoid, and an ethmoid bone. This is another picture of the skull. You can see most of the bones on this anterior view, however, you cannot see the occipital bone or the occiput on this view. When we look at the interior of the cranium, you'll notice that there are 3 areas where there is a pit or a depression. The word fossa means pit or depression. If we add an E to the word fossa, it creates the word fossae, which is the plural version of the word fossa. There are 3 cranial fossae created by the cranial bones. We have an anterior cranial fossa, a middle cranial fossa, and a posterior cranial fossa. These fossae are created to envelop the contours of the brain, which you can see on the upper right-hand side. As you look at the picture on the upper right-hand side, take a look at this particular structure right here. I'm going to color it yellow. That is the pituitary gland. We're going to talk about the pituitary gland and where it's going to sit in the skull. And I'm highlighting that on the picture of the skull. We'll get to that again. I just want to highlight it for you now. When we look at the cranial bones, beginning with the frontal bone, we can see that it forms the forehead as well as the roofs of the orbits that hold the eyeballs. The frontal bone also is responsible for constructing most of the anterior cranial floor. We see that the frontal bone has thickened supraorbital margins above the eye orbits. And this particular bone has spaces inside, which are known as the frontal sinuses. We're going to talk about the sinuses collectively. Here we have the laterally located parietal bones, which form the greater portions of the sides and the roof of the cranial cavity. On the posterior aspect of the skull, we see the occipital bone. If I put my hand over the occipital bone, my fingers are over a portion of it, and then coming up underneath and surrounding this hole would be the bottom portion of the occipital bone, which is otherwise known as occiput. The occipital bone forms the posterior portion and most of the base of the skull. The large hole that you notice in the occipital bone is referred to as the foramen magnum. The word foramen means hole and magnum means big. It's a big hole. The foramen magnum is an important structure because this is where the medulla oblongata of the brainstem connects to the spinal cord. On either side of the foramen magnum, you'll notice that there are smooth curved surfaces. These smooth curved surfaces are referred to as occipital condyles. The occipital condyles are going to form an articulation, which is a joint, with the first cervical vertebra called atlas. Because they're curved, 50% of nodding occurs between occiput and atlas. You'll notice there is a bump on the posterior aspect of the skull within the occipital bone. That is the external occipital protuberance. There is a line on either side of this bump, which is the superior nuchal line. There is a line that's lower and more inferior to the superior nuchal line, known as the inferior nuchal line. And the external occipital protuberance and the nuchal lines are important because they are areas of muscular and ligamentous attachment. The temporal bones are paired bones that form the inferior lateral sides of the skull and part of the cranial floor. With the temporal bones, we can see, turn you this way, that there are different parts of the temporal bone. It is very flat on the side. That is the squamous portion of the temporal bone. We see that there is a process right here coming out of the temporal bone and leading towards this bone, which is the zygomatic bone or the cheekbone. So this process on the temporal bone is called the zygomatic process of the temporal bone. It's called the zygomatic process because it takes us to the zygomatic bone. We'll notice that there is the mandibular fossa that will articulate with the condyles of the mandible, forming the temporomandibular joint. We can also see this needle-like process. That is the styloid process of the temporal bone. We can see the external acoustic or external auditory meatus, this hole right here. And then there's a big lump right here. This lump is the mastoid process of the temporal bone. The mastoid process is important because that will form an attachment for a muscle called sternocleidomastoid, which we'll learn about when we get to muscles. If we look on the interior surface of the cranial cavity, you'll notice that there is this rocky mountain type of structure here. That is referred to as the petrous portion of the temporal bone. There is a hole right here, which is the internal acoustic or internal auditory meatus. So the petrous portion of the temporal bone houses this big Rocky Mountain thing right here. This houses the middle and inner ear, and as sound waves come through the external auditory or external acoustic meatus, the nerves that exit the ear to go to the brain are going to come out through the internal acoustic or internal auditory meatus. The hole just inferior to that, which is right in here, is the carotid canal. The carotid canal is a canal that allows for the passage of the internal carotid artery that carries blood to the brain. This takes us to the sphenoid bone. The sphenoid bone is kind of a butterfly-shaped bone or bat-shaped bone. It is often referred to as the keystone of the cranial bones because it holds all of them together. And it lies in the middle of the base of the skull. One of the most important structures in the sphenoid bone is this guy right here, which is the sella turcica. That literally means Turk's seat, and that is where you will find the pituitary gland. The pterygoid processes of the sphenoid bone can be seen on this view. You can see these flat structures. Those are the pterygoid processes, which will form an attachment site for the pterygoid muscles, which are important in moving the mandible. There are other structures that are associated with the sphenoid bone, including 3 holes or foramina. We have, and it's difficult to show you on this, but I'll do my best, the foramen rotundum, and then the next one below it, the foramen ovale, which has an oval-shaped appearance, and then the foramen spinosum. There's a cute little mnemonic that says rigatoni over, I prefer rigatoni over spaghetti, so rotundum, ovale, spinosum. With the sphenoid bone, we also have an important structure known as the optic canal. You can see that here in the picture on the upper portion, and if I put these little pipe cleaners through the optic canals, they're coming through 2 little holes in the orbits of the eyes, and as those structures come through the optic canal in my skull, they actually cross, and this crossing of the optic nerves occurs in real life. The ethmoid bone is located in the anterior portion of the cranial floor, medial to the orbits. Here we can see the ethmoid bone in here. Okay, this little piece is part of the ethmoid bone, just medial to the orbits. You'll notice the piece anteriorly that sticks up. That is called the crista galli. The crista galli serves as a site of attachment for the dura mater of the meninges. That's the outermost layer of the meninges, which are groups of membranes that cover the brain and the spinal cord. You'll see that around the crista galli and posterior to it is a special area called the cribriform plate. The cribriform plate has tiny little holes that are known as olfactory foramina. These olfactory foramina allow for nerves coming from the nose to go to the brain to process information about the sense of smell. As we look into the nasal cavity, you'll notice there's a line towards the top. Okay, and it's right in here. This line that you can see coming straight down, the top 2/3 of that line are part of what is known as the perpendicular plate of the ethmoid bone. The little curved portions of bone that you see as you look inside this nasal cavity are the middle nasal concha. The one below is the inferior nasal concha. We cannot see the superior nasal concha on this model. The superior nasal concha are located so superiorly that they can't be seen. We can see them on this picture. Here we have a superior nasal concha another superior nasal concha. You can see them from the other side here in this picture. And then the middle nasal conchae, I should say it in plural, are located here. So we have the superior nasal conchae and the middle nasal conchae. The inferior nasal conchae are not part of the ethmoid bone. They are separate bones in and of themselves. They are part of the facial bones. They are not part of the cranial bones. However, the ethmoid bone is a part of the cranial bones because this does form part of the floor of the cranial cavity. The ethmoid bone contains a lot of air spaces as well. Those are the ethmoid sinuses. We will look at the sinuses collectively in a slide coming up. Here we have a really nice view of the lateral wall of the nasal cavity. You can see a part of the ethmoid bone here with those lines that are going vertically in this direction, representing the olfactory foramina. Here we have the superior nasal concha and the middle nasal concha. Wrapped around the conchae are mucous membranes, and the mucous membranes help to warm and moisten the air as it comes in through our nasal cavity so that when it gets down into our lungs, it's not cold and dry. Remember, the inferior nasal concha is a bone all by itself. Here we have a nice picture of the sphenoidal sinus, and here we see the sella turcica with a pituitary gland seated inside. On this lateral view, we also see a picture of the frontal sinus. We see those in these pictures. We see those sinuses in this picture on the right-hand side. However, it can be a little confusing for beginners, so I'm just going to keep going over this, and we'll look at a much more clear picture of sinuses. Sometimes during intramembranous ossification, the bone that's forming doesn't fuse together with the other portions of the bone that's forming to make a nice, clean, large cranial bone. And as a result, we find very commonly these little pieces of bone known as Wormian bones or sutural bones. They're just extra bone pieces, and they are often found in a suture, which is a type of joint between the skull bones. And the most common suture that we'll find Wormian or sutural bones in is known as the lambdoid suture. Okay, so the lambdoid suture, as you look at this highlight that I'm making with my highlighter, it looks like the Greek letter lambda. Technically, the lambdoid suture is just this part between the parietal bones and the occipital bone. There are 14 facial bones, and within these facial bones, most of them come in pairs. If we have 6 paired facial bones, that's 12 of the 14. The only 2 that are unpaired are the mandible and the vomer. There's a cute little nursing mnemonic if you want to learn this to remember what the facial bones are. It's vein MMPLZ, please. So it's up to you if you want to use that to learn which are the facial bones. It might be easier just to learn what the cranial bones are, and then you have fewer facial bones to remember if you know what the cranial bones are. Let's start our journey through facial bones with the mandible. The mandible is the lower portion of your jaw. The mandible is the only freely movable facial bone, and it is the largest, strongest facial bone. If we look at the mandible, You'll notice that there are mandibular condyles, which are smooth curved surfaces. These are going to articulate with the mandibular fossa of the temporal bone to form the temporomandibular joint. We also have the mandibular notch, which is this little notch. Here we have the coronoid process. Corona means crown, so if you think of the points on a crown, that's the coronoid process. Externally, there are two holes. Okay, so we've got one mental foramen, and then on this side we have the other mental foramen. So the mental foramina collectively are going to be found near the chin. Remember, this is mental when you learned about the regions. And then medially, we have holes entering on the inside portion of the mandible. And these are mandibular foramina. So on each side, we have mandibular foramina. By the way, that's where the inferior alveolar nerve is. So if you ever get a shot of Novocaine, way back, that's the nerve they're trying to numb, the inferior alveolar nerve. You'll notice there are alveolar margins that occur before the teeth. An alveolus is simply a sac-like structure. That's where they get that name. We have alveoli in the lungs. Those are little air sacs in the lungs. On the mandible, we notice that there is an angle of the mandible. This is the angle of the mandible. And we have the ramus of the mandible, which is right here. This is the ramus of the mandible. A ramus means an arm-like or branch-like extension. The body of the mandible is from about here, okay, from here to here. That's the body of the mandible. It's the anterior portion of the mandible. The zygomatic bone is also referred to as the cheekbone. And the zygomatic bone has a piece of it that reaches out towards the temporal bone. Just like the temporal bone has a zygomatic process where a piece of the temporal bone is reaching towards the zygomatic bone, the zygomatic bone has a little piece reaching towards the temporal bone, and that is the temporal process of the zygomatic bone. So here's the temporal process of the zygomatic bone. It's that little piece reaching back to the temporal bone. And as you can see, the zygomatic bone forms an articulation with the temporal bone, with the frontal bone, with the sphenoid bone, and also with the maxilla right here. Here we have another view of the maxilla, which forms most of the anterior portion of the face. There are maxillary sinuses in the maxilla. The maxillae, plural, are supposed to fuse together, and sometimes they don't. We'll take a look at what happens there. Now, just like the frontal bone that forms your forehead curves underneath to form the top of the orbit of the eye, the maxilla folds underneath in your mouth to form the anterior portion of the roof of your mouth. If we look at the maxilla, this portion right here where it folded over to form that anterior portion of the roof of your mouth, this portion is going to make up what's called the palatine process of the maxilla. Why is it called the palatine process of the maxilla? Well, this area joins the maxilla to these bones that are in green, the palatine bones. So here we have the maxilla, the palatine process of the maxilla, going toward the palatine bones in green. The palatine bones form the posterior portion of the hard palate, part of the nasal cavity, and a small part of the floor of the orbit of the eye. So here's the hard palate, the majority of which is formed by the maxilla. And then the posterior portion of the hard palate is formed by the palatine bones. So here we have the palatine process of the maxilla. And here we have the palatine bones. Now there are a bunch of holes in the skull, and we don't talk about every single one of them. But wherever you see a foramen or foramina, such as the greater palatine foramen, know that these holes are usually a conduit for blood vessels and nerves. If the maxillae fail to fuse together, then that can cause a condition known as a cleft palate. Depending on the severity of the cleft palate, there may be surgery required to repair the palate in order for a person to function more normally. We use our teeth for chewing and speaking and swallowing, and having the rest of the oral cavity intact is really important for normal function. So the hard palate, again, is made up of the maxillae anteriorly, the palatine bones posteriorly, and then at the end of the palatine bones is where the soft palate begins. And the soft palate is made up of cartilage and soft tissue and mucous membranes. Here we have a picture of the nasal bones. If you reach up on the top of your nose, the bridge of your nose, where if you were wearing glasses, they would sit, you can feel the hard nasal bones at the superiormost aspect of your nose. If you come down a little bit, you can actually feel where they drop off. And then you can feel the cartilage, which makes up the anterior portion of the nasal septum. So we have different areas of cartilage, and these are hyaline cartilage. Here we have the lacrimal bones. You can see the lacrimal bones on the skull. You can also see them, I'm going to remove myself here. You can see the lacrimal bone in beige on the picture on the right. You'll notice that there is an opening for a canal between the lacrimal bone and the maxilla that allows for tears to flow from the eye down into the nasal cavity. The lacrimal bones are the smallest facial bones. Here we have a great representation of the inferior nasal concha. You can see it in green. You can see how it's just a bone all by itself. There's one on either side. When you look into the nasal cavity of this skull, that's the lower of the two curved structures inside against the wall of the nasal cavity. So right there on the inside is the inferior nasal concha. And the conchae are curved to allow air to swirl around them, again, to become moistened and heated as air flows in through our nasal cavity, going down towards the lungs. Here we have the vomer. The vomer forms the inferior portion of the nasal septum. So you can see the vomer down here on this picture on the left. It's the inferior, approximately third of the nasal septum, and then the perpendicular plate of the ethmoid bone forms this superior portion of the nasal septum. I really like this view on the lateral picture that you see on your right-hand side. The vomer is outlined in green. It literally means plow, so it appears as if it's plowing through. And again, you can get a much better appreciation for the vomer. We can see the ethmoid bone with the crista galli here. The cribriform plate would surround it here. And then the perpendicular plate of the ethmoid bone is right here. So we've got the ethmoid bone superiorly, the vomer inferiorly, and the rest of the nasal septum is made up with hyaline cartilage. Here's another picture of the nasal septum. So we have the perpendicular plate of the ethmoid bone here. You can see the crista galli of the ethmoid here, the cribriform plate with the olfactory foramina. Here we have the vomer. And again, the septal cartilage is hyaline cartilage. This takes us to the auditory ossicles. These are the three smallest bones in the human body. You can see very easily how the malleus, incus, and stapes are so tiny compared to the size of a dime. And the malleus is going to be the most external of the three bones. This is going to be attached to the tympanic membrane, which you may know as the eardrum. So when the eardrum or tympanic membrane vibrates when sound waves enter the external acoustic meatus, because the malleus is attached to the eardrum, that tympanic membrane, that causes the malleus to vibrate, which in turn causes the incus to vibrate, which in turn causes the stapes to vibrate. And the stapes is attached to another structure that will vibrate fluid for it to circulate and produce sound. Here we have a nice picture of the orbit of the eye. It's made up of 3 cranial bones. The frontal bone makes up the majority of the orbit, as you can see, and the sphenoid and ethmoid bones also contribute to the orbit, as do the 4 facial bones of the palatine, zygomatic, lacrimal, and maxilla. Those all contribute to the orbit of the eye, some more so than others, but the frontal bone really is one of the major contributors. Here we have the paranasal sinuses. Now, I've discussed these a lot so far because we keep hitting them in different bones. In the frontal bone, we have the frontal sinuses. So there's one on each side of the frontal bone. We have in the sphenoid bone the sphenoid sinus. I want you to pay close attention because the ethmoid bone is located anteriorly to the sphenoid bone. Okay, let's take a look at this. Here we have anterior, posterior. We know posterior because of the foramen magnum as part of the occiput. So if we look here, we've got the cribriform plate and cristogalli of the ethmoid bone. Here is the sphenoid bone. So ethmoid is anterior to sphenoid. Looking at this picture, you can see the ethmoid sinuses are anterior to the sphenoid sinus, which is right here. And then in the maxillae, maxilla is singular, maxillae with an E on the end is plural. In the maxillae, we have a maxillary sinus in each maxilla. So all of the sinuses, the paranasal sinuses, contribute to lightening the skull. They add resonance to your voice when you speak. They all communicate with the nasal cavity. They're filled with air, yet they're lined with nasal mucosa so that air can be warmed and moistened and move more freely through those cavities. Sutures are special types of joints that connect the bones of the skull together. When we look at the sutures of the cranium, we've got connecting the frontal bone with the parietal bones, the coronal suture. It's on the upper right-hand side of the screen. Be careful that you call it the coronal suture as opposed to the frontal suture. It is a frontal plane of dissection, however, the suture is only referred to as the coronal suture. Connecting the two parietal bones, we have the sagittal suture. Connecting the parietal and temporal bones, we have the squamous suture. Why is it called the squamous suture? Because the sides of the head are flat. Connecting the parietal bones with occiput, we have the lambdoid suture. Lambdoid. It looks like the Greek letter lambda if you have this little additional line at the top. Notice that where the parietal bones, temporal bone, and frontal bone meet, this juncture on the skull is referred to as the pterion, and the pterion is the weakest part of the skull. We know that cranial bones form through a process known as intramembranous ossification. Intramembranous ossification allows there to be membrane that hasn't turned into bone prior to and after birth to allow the baby's head to change shape in order to fit through a birth canal. The areas of membrane that have not yet ossified are referred to as fontanelles. Most people are familiar with the anterior fontanelle because that's the one found at the top of the head, which most people call the soft spot. So there are different fontanelles throughout the skull, including the anterior fontanelle. There's also a posterior fontanelle. There is a mastoid fontanelle and a sphenoidal fontanelle. So minutes after the baby is born, his or her head looks very misshapen, but it only takes a day for that baby's head to reshape into what we would consider a more normal appearance. Intramembranous ossification will continue to fill in the fontanelles and approximate the bones. Now, between the two frontal bones, you can see there are two pieces of frontal bone. There will actually be a fusion that occurs to make one complete bone. That does not remain as a suture. However, between the frontal and parietal bones, we'll have the coronal suture. Between the two parietal bones, the sagittal suture. Between the parietal and temporal bones, the squamous suture. And between the parietal and occipital bones, the lambdoid suture will still persist. So the bone, as it continues to develop in the process of intramembranous ossification, will approximate, with the only exception being the two pieces of frontal bone which actually fuse together and form one piece of bone.